Reagan asked Secretary Schweiker, or at that time Senator Schweiker from Pennsylvania, to be the Secretary of HHS. And he had heard that David Stockman wanted to do the cut 30% cap and block business and send everything out from HEW as one grant. Schweiker was interested in prevention, and he told Reagan, I'm not taking the job unless you have 2 block grants for services and prevention. And Reagan wanted him badly, and that's what happened. When the hearing started, Sheila Burke, who was Bob Dole's chief, a nurse professional, Sheila and I realized that if you send out big boluses of money to the states in healthcare, pregnant women and children, maternal child health programs will get destroyed. We talked to Dole and Dermerberger about that. They said, we'll set up a hearing, and we got a fellow who came from Alabama. His name was Bill Roper. He later became the secretary of HCFA, which is now CMS, Medicare, Medicaid. And Bill was a former pediatric resident of mine 10 years earlier in Colorado. He was in Alabama, and he clearly demonstrated the impact at the state level. Alabama had decided to cut 3 days out of the 180 days at reimbursed nursing homes, and it passed on first reading. Second reading happened the next day, by which time 14 busloads of disabled elderly were brought by the nursing homes to the Capitol, and they repealed that, put it back to 180, and cut out the first trimester of pregnancy care for poor women in Alabama. And Bill then had the data to show 1, 2, 3 years later the increase in maternal and neonatal mortality. And when he presented that, Dole and Dermerberger turned to us and said, write a maternal child health block grant, we'll get it through. And on August 1st of 1981, the last day of the session, COBRA, the first Comprehensive Omnibus Reconciliation Act, passed, and the maternal child health block grant was in it. And I left the next day and started the long drive west back to Colorado, feeling pretty good about how that year had gone.